Hey, everybody. Welcome to Grip and Contemplate. I'm Chris,
I'm Brittany.
and this is a place for real people to have real conversations.
We are here to experience real thoughts and feelings, but just be warned, there may be some oversharing.
Yes, maybe and always oversharing. So, one of the things I'm really excited about being able to do with this, and I would hope you are too, is because it's long form, we really have an opportunity to talk for real at length and not have to worry about like commercial breaks about
Right.
anything like that. And Brittany and I have known each other for a very long time, and we know a lot about each other's personality and sort of present life, but we don't know a lot about all the stuff that's happened in our lives really before we met. So this is a great opportunity to really just put each other in the hot seat and interview away and dig in to get some questions answered about why do you do this? Why did you choose this? And I think, well, this week will be Brittany in the hot seat, and next week it'll be me. So yeah, I would say. And by the way, if any of you have questions that you want answered, definitely send them in. You can DM them, right, or leave them in the comment section on Instagram or even YouTube, whatever you want.
We're open.
So we're open to it. Which doesn't mean I'm going to remember to check them, but if I do, I'm not ignoring you.
Typical male fashion.
Yeah. Listen, I'll get back to you when I remember. No, I really would check. And plus, more importantly, Brittany's really monitoring that. So there's a high likelihood that your message will be acknowledged at any point. So,
oh my God.
So right now, Brittany, what do you do for work?
I am an ultrasound tech or diagnostic medical sonographer.
And how long have you been doing that?
Going on a decade, maybe a little bit over.
So pretty much you graduated college and went in that field, or presumably chose that field during college, I would think, or even before.
So I got my bachelor's degree in biology because you either need a Bachelor of Science or an X-ray certificate to get into the ultrasound program. So I went to Plymouth State, got my bachelor in biology, and then graduated, worked for a year as a medical assistant in a dermatology office, and then went to ultrasound.
So what made you pick the medical field to begin with? I mean, obviously there's a lot of jobs in the medical field, but why go life science in college and why pursue medicine?
I really liked helping people. So I knew that I wanted to do something in the medical profession. Also, there's a sense of security there, meaning you'll pretty much always have a job. And my mom is I'm saying sonographer. She's an ultrasound tech as well.
Oh yeah, because it can sound like stenographer, which is a totally different game.
Very different. So my mom is an ultrasound tech as well, and has been for like 38 years. So I shadowed her, and it piqued my interest because obviously it's a big part of the medical field, and also there's a lot of facets in it. So there's vascular, general, obstetrics, breast, musculoskeletal, pediatric. You can basically, it's like all of this under the ultrasound umbrella.
Yeah, that's pretty wild because I guess it makes sense to think about it, but it's like, well, somebody's got to scan that, yeah. All that stuff. And it's like, I guess it just happens. So beyond I would say, like, were there any specialized courses that you took in college? Like that, I mean, I guess anatomy and physiology, I would think, and all that stuff.
Yeah. I think basically you had to have the Bachelor of Science because you had to take those prerequisite courses of like anatomy and phys 1 and 2.
Yeah.
I think pretty standard, like English, chemistry. I think like calc was one of them. microbiology.
I mean, that all sounds reasonable. Like if there's some gen eds mixed in there, and then obviously the specialized stuff. Did you do any cadaver work?
We did. I mean, we did a bit of it in anatomy and phys in college. We didn't do any when I was in ultrasound, when I was like in the program for ultrasound specifically, because the first semester of ultrasound school, you're basically scanning each other, and
Yeah.
I don't know how the program is now, but when I applied, it was like really competitive. There was like hundreds of applicants and only 8 people were accepted.
That is insane. That is
Yeah.
unbelievably competitive. Well, congratulations, because that is obviously not easy to get in.
But we scanned each other for a while, and then you get assigned to clinical sites. So I think my first clinical site was Elliott Hospital in Dartmouth in Nashua. And then I got assigned to Monadnock in Peterborough. And then I was at Dartmouth in Manchester, and then Dartmouth in Lebanon.
So when you're assigned to these various things when you're at school, do you find that, in addition to learning about it, you're also making these connections, and is it normal for people to then go back to work at these places, or at least get recommendations from them?
Mm-hmm. A lot of I think some places at the time where you'd recruit the students you like, right?
Yeah.
Like if you have a student who comes through and you're like, wow, I'm really impressed with their skills. Places would like put out feelers.
Oh, that's cool. I mean, I guess that makes a lot of sense.
Yeah, absolutely. And I mean, the field itself is so small, so it's helpful when you're going through clinical sites to like make connections with sonographers, because everyone knows everyone.
Yeah, I guess. Well, I guess when you only have 8 people in a class, that it really must be that kind of thing. Well, actually, okay. So I have a question about that, but before we get to the second one, so obviously all these specialties inside sonography, and when you're in school, you spend the first long while scanning each other. Now, when you're scanning each other, are you also exploring the different areas of sonographies, like you would do vascular stuff on each other and musculoskeletal, or was it tended to be more one area of the body?
I would say it was. I don't want to say it was everything, because we didn't start vascular in school. You kind of dabbled into that depending on where you go to clinical sites, but when we were scanning each other, it was pretty much like abdomen, looking at like liver, pancreas, kidneys, spleen, GYN, like uterine, ovaries.
And did you have a favorite at that time, or one that you found more fascinating, or something like that?
Yes. I always liked musculoskeletal for obvious reasons. But I actually didn't really get experience in that until I started working at Dartmouth in Manchester. But at the time, I would say that I was pretty comfortable just doing like general ultrasound. So like liver, just like somebody's standard abdomen. I actually hated obstetrics when I was.
And that's what you do now, right? And so how did that happen? I'm obviously, it's perhaps not an uncommon road, but it could be a strange one, I suppose, to go from something that you hate to presumably something I think that you really love now.
Oh, I love it now.
So how did that happen?
So I started working at Dartmouth in Manchester in right before 2015. I would say I worked there, and they do everything. So you do breast, musculoskeletal, biopsies with the radiologist, general, and obstetrics. So I was, when I first started there, I did obstetrics, but to a smaller extent. And then one of our sonographers had gone out on maternity leave, and they needed somebody to start doing maternal fetal medicine, which is what I do now. It's high risk ultrasound. Um, and so I kind of like got thrown to the wolves in that aspect. Um, and honestly, I just like rose to the occasion, and I actually like really loved it.
So what was the part about that you felt like, I really don't like doing this? How did that part come up?
Honestly, when I was up in Lebanon as a student, I did go up to the high risk department a couple times, and I think I saw anomalies there when I was like scanning as a student, and how people like took that news, and that you're dealing with like another life.
Right.
And really, frankly, at the time as a student, you're kind of like watching over the sonographer's shoulder, and like I remember seeing the screen and saying like, oh, I think I know what she's looking at.
Yeah.
I was like, oh, that's the baby's like stomach, and she labeled it part of the baby's brain, and I was like, I don't even know what the fuck I'm looking at. I'm never gonna be able to do this.
Well, some people would say that's their second brain.
Yeah, it's true.
You're not far off. Well, actually, okay, so that I was going to ask about that anyway, but now I guess it's not as good time to talk. How the hell do you know what you're looking at? Right? I mean, like, it must take some time to recognize what you're actually seeing, right?
Absolutely. I think in any like ultrasound case, but specifically with obstetrics, it takes a lot of practice to know what you're looking at.
So how does that work in the schooling, right? There must be orientation to like, this is what this looks like with this kind of rendering, right? Because you had mentioned, I think earlier in a conversation that we had, not on this podcast, but that the cadaver lab, as valuable as it is, doesn't really prepare you actually very much for the ultrasound world, because the things don't appear to be the same, or they just show up differently.
Correct.
Than you'd expect them to.
Like you're scanning using, so you're in 2 dimensions, right? But it's also like sound coming from your probe, reverberating back from what you're looking at and creating a picture on a screen.
Right.
So you're not like cutting into something.
That is just a wild thing.
It is.
So how long did it take you to get, I guess what you would call like, I don't want to say good enough because that sounds weird, but
like proficient.
Proficient. How long did it take you to become proficient looking at fetal ultrasounds, being like, I know exactly what's happening here?
Oh God. Probably over 5, maybe 5 years, maybe under 5 years. But it was a handful of years. And even now, I'll see cases sometimes that I'm scanning, and it's hard to describe. So say I'm looking at a fetal heart, right? And I'm like, you have the right ventricle, the right atrium, the left ventricle, the left atrium. But when you see something abnormal, right, you're then trying to like decipher what it is you're actually seeing.
Right.
So you're like, okay, I see the right ventricle, check. I don't see the left ventricle. I don't see the left atrium. So like in your head while you're scanning, getting all of these things that you need to check off, especially with fetal life, you're then also trying to like come up with a diagnosis of like what is happening. So we have a checklist, and I probably should have printed this out for like accuracy, but we have a checklist of what we need in a fetal ultrasound. It's probably about 50, 60 things.
Yeah, I mean, that in a way, that seems like a long list. In another way, it seems like a very short list, considering what a pre-owned Honda is, 102 or something like that. I don't remember. You'd think I'd remember, considering I did it as a summer job. But yeah, there's obviously a lot a lot to look for. But at the same time, that must be an enormous weight to carry.
It
Is it?
is.
I mean, I remember, and I actually can't remember if it was you or Stephanie who posted this on Facebook, and I don't know if it was like a poem, but it was definitely a tip of the cap or a poem of appreciation or some kind of, you know, to familiarize people who weren't sonographers or maybe didn't know one what it's really like. And there were a lot of aspects to it, but the line that really stuck out to me the most and like really just like hit me like holy shit was, "We see the cancer before your doctor does." And I was like, Jesus Christ, what that has got to be an immense. It just has to be such an incredible weight to carry. How, and so how do you all deal with that?
Well, I think just like with anything, people deal with things differently, right? I mean, I definitely think my de-stressor is the gym for sure.
Yeah.
But I think I deal with it like you feel your feelings, right? And it's hard to feel somebody else's feelings for them.
Yeah.
But when you are arguably scanning somebody and you're connecting with them, right? Like you're having a conversation, you kind of like start getting to like know them to like a lesser extent, but
Sure.
and then boom, you see something that you know is going to change their life forever. It's difficult to to number one articulate that to the patient, but
Yeah.
also to try and be there for them while dealing with it yourself, right?
Right.
Um, I definitely think that there's no easy part of it, right? Like I've seen metastases, which is like cancer from somewhere else spreading throughout someone's body, right? I've seen metastases when I've done an ultrasound. I've seen ovarian cancer. I've seen testicular cancer. Um, it it none of that is easy, but I would say obstetrics is the hardest thing to deal with.
Yeah, I would think. I mean,
And
yeah,
and
yeah.
that's not to shortchange what somebody's dealing with, especially we like I said, we've seen all types of cancer, breast cancer. No matter what, it changes somebody's life. But fetal ultrasound and what we are looking for and the stuff that we see is like heartbreaking.
I cannot imagine what that is like. I mean, you know, you well, I mean, I guess I know you don't deliver the news necessarily, but I mean, maybe officially, but you know that this person is getting is going to hear at some point probably the worst news that any human being can get.
Correct.
And as you say, what makes it worse is it's as bad as it is to hear it about your body, I would assume it's got to be a trillion times worse to hear it about this life in your. I mean, you're already having hopes and dreams about this person. You already know this person. This person's with you all the time, and then oh my god. And so when do you? How long throughout pregnancy do you say that these things? Do you normally see them, or depending on the type of thing you're looking for, it's obviously developmentally
Correct.
you know.
It depends what it is. I mean, we've seen anencephaly is basically where the skull doesn't form, and we can see that as soon as like 8, 9, 10 weeks. Other structural anomalies we typically don't see until somebody gets their anatomy scan, which is like primarily at 18 weeks.
Yeah.
But I mean, it's fetal is devastating because undoubtedly every time you can see what goes through the mom's head, and it's like, what did I do?
Yeah. Oh my God. That
Like, what did I do? What could I have done differently? Why did this happen? And so, because I think really in any aspect of our life, and we've talked about this and why we like lifting, you grasp onto something that you can control, right?
right.
And pregnancy is one of the most humbling things because you quite literally can't control any of it.
It's it is a it is a crazy thing because I well I obviously can't imagine it, but cannot imagine it. But I guess we sort of as humans live in this world where we kind of act as if we have more control than we do, and then something like that is your body is doing all these things, but it's doing it without your input. Really, right? It's like, hey, look, this is the hormones are going to be released at this time, and these types of cells are going to develop at this time, and boom, 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 boom. It's got to be a wild thing.
All like maternal fetal medicine and high risk ultrasound, I love doing because you do form connections with people. And it has been some of the hardest moments of my life to tell women that, like, I know you've worked so hard for this, but like, I've had to tell news of people who have like kept the pregnancy and done, gone through whatever the baby needs to as far as treatment. But there's also a lot of conditions that aren't compatible with life. So, I mean,
God, even that phrase, is euphemistic as it is still just like devastating.
well, absolutely. And, we can get political with this too, right? But like, I don't think that people, and this is my opinion, I cannot tell people how to think, right? But I truly feel as though people cannot make a decision between pro life and pro choice until they sit in on what the amount of things that can actually go wrong in a pregnancy.
Yeah.
And then on top of that, you also have to think of people's family dynamic at home.
Right.
Is this their first child? Do they have children at home that need their attention? And this being inside them is going to require 100%, almost like nearly all of you. It just gives a totally different perspective of, it paints a different picture.
Yeah. Yeah, I would think.
But I think I have cried more doing high risk fetal ultrasound than I have in majority other like aspects of my career.
Oh my God. I would. I would think. So, you've used the phrase high risk many, many times, and I haven't asked really what that actually means. So, what is high risk in your what you're doing?
So there's criteria for somebody to meet high risk. And there's a number of things that can entail this, but if your BMI is over 30, you're considered high risk. If you're over 35 years of age, you're considered high risk. If you've had any type of complication or abnormality in a previous pregnancy, you're considered high risk. If you've had like a certain number of C-sections, you're considered high risk. If you have pre-existing diabetes, if you develop gestational diabetes, if you have, chronic hypertension, the list goes on and on. But, those are primarily the things that make consider like that somebody would be considered high risk pregnancy.
So let me ask you this: especially in conjunction with what you just said, but also something you mentioned much earlier on, which is this desire to really help people. How does that manifest for you at work, or hopefully in your life outside of work? Because it seems like there are so many things, especially given what you've talked about during this conversation, that are outside of seemingly everyone's control. And so, how do you um, feel like, or are able to help someone, whatever that means?
So I'll use a couple examples. Just
Yeah,
to So Kathleen actually, and I'll kind of go into it. Kathleen Beatty is a physical therapist that we all know, who is awesome, by the way.
yeah, for
But
sure.
she had recommended. I'm going to go kind of off a little bit just to get back onto topic.
Well, that's what this
She had
podcast is about.
recommended, yeah, typical, right? A book called The Big Leap. And so in the book, this, I think he was a psychologist by trade or a therapist of some sort, but he talks about finding your zone of genius, right? So, like, whatever you're doing, finding something that, like, a lot of us live in a zone of excellence, but we need to find a zone of genius where we're like basically not surviving, we're like thriving. And so for me, helping people was like was that. How can I help people? I love talking to people. And a couple examples within my career. I had a gentleman, God, this was pre-COVID. He came in, he was coming in for an abdominal ultrasound, probably early 60s, for HCC surveillance, which is hepatocellular carcinoma surveillance, right? And people can come in for this specific thing for a number of reasons, not because they've had this, but examples include people who have had fatty liver. This particular gentleman kind of drank himself to this test. And, read his history, went out and called him from the waiting room. Very grumpy fellow. Came back and I was like, oh, my name's Brittany. It's nice to meet you. I'm going to be doing your ultrasound. He's like, yep, you already know my name. I'm holding a requisition that has his name on it. So I'm like, yep. I get in the room and he reeks of alcohol. And so I start talking to him a little bit. He's like kind of giving me one word answers. And so I was like, is this how you are in your daily life? I presume you drank this morning. Otherwise you were up all night drinking because you reek of alcohol. And he kind of just sat there and stared at me. And I opened up a little bit about, like, my dad and his drinking habits. And he ended up just like opening the floodgates on kind of his life. Him and his wife are retired, but have custody of their granddaughter. He's been a drinker for as long as he can remember. And so we basically, I think I was probably in the room with him for 40 minutes. My exam didn't take that long, but I was chatting with him. Long story short, we talked about, like, I was like, have you ever considered, volunteering at a rehab? Who do addicts want to hear from? Are addicts themselves.
Right, because
You
otherwise,
know,
who are you? Like, you
yeah,
can't possibly understand it.
100%. So he left that day. And to be honest with you, it was a great conversation, but what went through my mind, and I think this was from, my childhood, is like, this is going to fall on deaf ears. Right.
Yeah.
So he left, and probably 3 months later came back and was actually getting a CAT scan. And he asked for me. He came back to ultrasound and he was like, I just want to thank you because that day I went to the Farnham Center and I got sober.
That's amazing.
And that to me is just like, that sums up what I love about my job.
Yeah. Yeah, I can see that. That's got to be. I feel like, we don't often get to experience that kind of feeling.
Not at all. I mean,
That's really nice.
in the fetal world, I've equally had devastating things happen to people, and just being there for them, like hugging them, treating them as humans. Like, I'm so sorry this happened to you. Sharing stories, it opens up, I think, a human aspect for people that like you might otherwise not get.
Yeah.
You walk through a grocery store, you could see like somebody that but you don't get into personal you don't often get into deep conversations with people, and I think we are so quick to see somebody who's in a bad mood or like, like, what is their problem? Instead of like actually thinking like, okay, actually this person could have a big problem, or you don't know that the news that somebody just got.
Right.
But yeah, I've made a lot of like really deep connections similar to the story that I just told, but like in really all aspects of ultrasound, obstetrics especially too, because in the high risk world, you're oftentimes scanning people several times.
Yeah.
And just being there, just like that manifests what I love doing deep down. And that's how ultrasound taps into that.
You told me, yeah, that makes a lot of sense. You told me a story a long time ago. God, it's years and years and years ago now, because I think you and I were having a somewhat similar conversation. And you had said you had a patient come in, and I think that either the ultrasound had confirmed it, or it was just checking on progress, and she knew that this was terminal.
Yeah.
And I think you said you read a poem together, right? She had a book that she was reading through, I believe, like the Don't Look for Me and the.
Yes.
I can't wish I could remember the prose, but it's really beautiful. It's really beautiful work.
Well, and it's like I said, it's special moments like that, and it makes you appreciate hearing from. I do remember the scenario we're talking about, and like hearing from somebody who's terminal, and they're positive. Like meaning like a positive attitude.
Oh, right. Oh, yeah. It seems.
And you just like, it really makes you stop to think about like really what you're thankful for.
Right. Like, what exactly am I complaining about again?
Exactly. Well, that very woman, that very patient actually had she told me, because I said that very thing that you just said. I was like, it makes you feel like, what am I complaining about? And she is like, well, what you're concerned about is also valid. And I'm like,
You're not helping. You're not helping. You're just making me feel even worse.
If I was that patient, I'd be like, yeah, fuck you. You're like,
yeah.
What do you?
What happened? Yeah, what happened? Your protein shake didn't get here on time?
But yeah, she read a poem, and it was like, I sobbed.
Yeah.
Equally, I will never forget, at Dartmouth in Manchester, and I scanned a patient who was 40 weeks, 5 days pregnant, brought her in, and the baby was dead.
Oh my God.
And she was there by herself.
Oh my God.
I left that room and just lost it. Really thinking about the fact that this woman is now going to have to go to the hospital and be induced to deliver something that is no longer living.
Oh my God.
But all of these scenarios, there is a lot more good than there is bad. But it just makes you thankful. It makes you thankful that you are here and that you are able to like help to whatever extent you can.
Well, so what are some of the positive ones? Like, what are the ones you're like, wow, that was awesome, or I'm so glad that I could experience this with you, or
When we used to do reproductive endocrinology at Dartmouth, I remember a particular couple who had gone through, God, it must have been like 7 or 8 rounds of IVF, which is in vitro fertilization, for those who don't know. But failed attempts. They would do the IVF. Unfortunately, it wouldn't stick.
yeah.
She ended up actually getting pregnant naturally. They called it. They called it and they were like, you know what? Obviously, this isn't meant to be for us. We're going to try the adoption route. And she came back and was pregnant. And I thought that they had gone somewhere else for IVF, and no, they got pregnant naturally. And I was able to be a part of her experience, like during her pregnancy. And that was like very, very, like super happy for the patient.
Yeah.
And a great experience.
That's really cool.
I mean, that stumped me. Let me try. I think there's been a lot of positive experience. Like I've scanned people that have like been post-cancer and post-treatment, and like just even scanning them, talking about their previous experiences and how they're living life now. I think scanning pediatrics, and like I've actually scanned kids, like fetuses in the womb, and then scanned them outside.
Oh, that's cool.
So that's really cool. But like I just think there are many facets that I enjoy. I love musculoskeletal, and I get to do injections and biopsies and such with the radiologists. Dartmouth does a lot of musculoskeletal exams, so that's fun. But yeah.
So on the musculoskeletal thing, you obviously have a lot of experience with it. So when you injure yourself, do you think to yourself, I know what this is, and I'm going to go scan it? And you're like, oh, I was right. Or like, oh my God, I was wrong. I have a much bigger, I injured myself way worse than I thought.
Probably a little bit of both. Like, I mean, I certainly don't know everything when it comes to that. I would like to think, oh, if it hurts, I can scan it.
Yeah.
Ultrasound does have its pros and its cons, right? We're not great for everything, but I mean, we've had issues with our elbows forever, right?
Oh yeah.
I've scanned my ulnar nerve several times, and it's significantly larger than it should be.
Like, yeah, well, here we go.
Does it stop me? No.
Well, sometimes it's like, okay, this hurts. And it's like, okay, well, is this the kind of hurt that is actually indicating a significant injury or risk of one? Or is this the kind of hurt that's like, my body's complaining about it because it's not optimal, but it's just going to keep complaining. So I'm just going to keep doing it if I'm not going to make it worse or whatever. Yeah, I've certainly done that without I guess the benefit of a
Um,
ultrasound. Like, well, it hurts, but they don't think anything snapped.
yeah. Well, when I dislocated my shoulder, what do you think the first thing I did was? I scanned myself.
I know that's not true. The first thing you did was probably try to immediately re-engage in whatever activity you did that blew it out.
Yeah.
Like, oh, you know what? It's probably just an adhesion. I'm sure it's fine. I'll just get right back into it.
That is also true.
I'll just try to do a pull-up. That'll fix it.
Pull ups the first time that I dislocated. I like the next day I was trying to do pull ups.
Well, look, I can't say anything because when I crushed my nerve at C6, I told you this the next day. I think we might have did this last episode. I was like, you know what? Look, I know that, I got stapled under this weight that I would have been able to do for many, many reps. But I think if the chiropractor can just make this small tweak, I'm sure all that'll disappear and everything will be great. And I'll max out again in like 5 days. So yeah, it's
super practical.
Super practical. I remember the PT told me, he's like, well, let's assume that there is like, there might not be nerve damage, but if there is, like, your nerves will heal like 1 centimeter a month. I was like, 1 centimeter a month? Can we do anything to speed this up? He's like, no. God damn it.
The world and the instant gratification.
I was like, what the hell am I going to do? Besides like feel sorry for myself.
Oh, I mean, that's the story of our lives.
Well,
right?
yeah, there's a lot of that. So when you are all at work, I mean, there must be, I would think, well, on the one hand, I would hope some kind of a support system because, you're all seeing either good things or bad things, or obviously a mix of all those experiences. So can you lean on your coworkers typically, or not really because everyone's got their own stuff, or it depends where you are, or?
I think it definitely depends where we are. I do think you form, just with any other coworkers, right? Like,
yeah,
the people who are in your field know what you're dealing with best. I mean, I think you certainly can lean on coworkers. I like my mom, because she's in the field, that's an added benefit.
yeah.
But I mean, equally, I talk to friends, I talk to you guys, and it's like, even though you're not in the field scanning, you can, like, you have empathy, to like, to know like what somebody could be going through.
Right.
But it is funny because when you ask that, we don't have like specific counselors at work that are like helping us through this. And I'm taking a breath work course with Kathleen. And we can save this for another episode, but her name's Brenna and it's called Alpha Wave Academy. And she actually asked that very same question. She was like, but what do you do to help yourself? And I don't have a good answer for that.
Is this a trick question? Nothing. What are you talking about? Help me. What?
I think I was always so concerned with helping everyone else because I'm like, well, it's like, I'm helping them through this because they're going through it. But she was like, but you're also like going through it. You are telling these people this huge news or like seeing this, and you can't unsee that.
Right. Right.
But I think me dealing with it is like I said, definitely the gym. And I think me helping people through it to whatever extent I can helps me. Right. So like,
Well,
friends with some of the people that I've told horrible news to. And, we've bonded and shared stories. And that to me turns it around.
Yeah. Yeah, I can see that. So, would you do it again? Would you pick high risk?
I like to.
Obstetrics to do it again?
Yeah, I think I would, or I know I would. Yeah,
That's
I
really awesome.
I have a big passion for it, and I think that it feeds that helping people portion of me, which I don't otherwise think I could get that in another field.
What would you say to recent graduate Brittanie, who's like, fuck that, bro, I'm never doing that shit?
I would say be open-minded.
Yeah.
And I mean, I could say that to a lot of aspects of my life, really.
Well,
If
listen, I mean,
hindsight's always 20/20.
There isn't enough data in the universe to cover the amount of time it would take for me to list all the things I would tell myself from fucking yesterday. Forget about when I was like 18.
I know. But we wouldn't be here had we not felt those.
I know. That's the point. Aren't you listening?
Oh, but that's me on the hot seat.
That is you on the hot seat. And it's just been really great. I know we normally we kind of do a lot of back and forth, but this has been really cool. So I certainly appreciate your honesty and openness. And I'm sure everyone listening will too. And then next week, it's me. So
You hot seat.
So strap in, everybody, because there's no way you're getting how I got to my forever home in less than an hour. We got a long way to go and a lot to cover.
We're going to keep them on track, folks.
Yeah, we're going to do our best. We even have an outline now. So this is good. We're making a lot of progress here.
You can shout out to Jerry.
I will shout out to Jerry. Like, we have an outline now. We've done some pre-production, which is good. And I want to, you know what? I'll bridge this to the next episode at one point. But I think a lot of people listening, if they hadn't known you for a long time, and like, this is going to sound weird to say it like this, but if they hadn't known you for a long time and know some of the ways that you describe yourself, would have tremendous difficulty being okay with the label that you sometimes give yourself, which is like the Ice Queen. And it's like, you've described yourself like that to me before. And I'm like, or at least have said some people think you're the Ice Queen. Maybe that's more accurate. And I was like, I don't know, man. You can't care this much and be, this sort of this apathetic at a distance. Like, you can be mad. I mean, you can't. I mean, being mad is you have to care about something to be mad. As they say, the opposite of love is not hate; it's indifference.
Yeah.
And you're not indifferent.
No.
So it's I'm glad people got to see and hear all this for if they hadn't known it already. So
well, I appreciate you.
Yeah, I appreciate you too. And I appreciate them and everyone listening. And I hope you've really enjoyed this because I have, and hopefully you have as well.
I have, and next time will be you, so we'll enjoy that. Well,
Volume 1.
Yeah.
Volume 1, the early years. All right, everybody, have a great week.
Bye.
Bye-bye.